Australian Government Chief Medical Officer Professor Brendan Murphy is giving an update on the coronavirus outbreak.
Come from the Hubei province, left that province before it was locked down and developed symptoms. There is still no evidence yet of sustained human-to-human transmission outside of the Hubei province. In Australia, our focus, as I've said on many occasions, is the early detection of anyone who may have come from China, particularly the Hubei province, within the last 2 weeks, the incubation period being up to 14 days. And our message remains the same. If you develop flu-like symptoms, fever, cough, contact either your GP or your local emergency department. Tell them before you come that you've had that relevant travel history to China and tend to be tested. The majority of people that have been tested turn out to be negative. We have increased some of the border measures today. As we've previously advised, every flight from China now is being met by border security officers who are going on the plane and distributing information to every passenger, trying to identify any unwell passengers. The airlines are also required to identify any unwell passengers, and if they are unwell, there's a process of screening them. Every passenger on those flights from China is given an information sheet in Chinese and Mandarin, Mandarin and English, and told to undertake, to watch themselves and to contact their doctor or their emergency department should they develop symptoms over the following 14 days. In addition, because there are some people who could come from China via other countries and other ports within 14 days, we are now making announcements in the arrivals halls of airports, again in English and Mandarin, pointing out that anyone who may have come from China from whatever flight or whatever port they're on, pointing out the risks and identifying that there is printed material available for them to collect at the airport if they've come from China, so that all of the people who may have come from China can get that information. Again, we have no evidence that there is a risk to the Australian public. There's no human-to-human transmission that's been identified in this country. I convened this afternoon the Australian Health Protection Principal Committee, and we have been looking at the data. And as I said, the concern, I think, is the number of cases outside of the Hubei province in China, and that's why we are starting to look at people who've come from parts of China other than Hubei as potentially at risk, although our focus still remains on that Hubei province of China, which is the epicentre and which is the only place where human-to-human transmission has been identified. So I think I might leave it at that and be happy to take any questions.
There's huge numbers of Chinese travellers, 43 flights into Australia today. This messaging and these pamphlets, is that really enough to kind of deter this?
Well, I think the important thing is that everybody who comes from China is aware of the risk. The risk is probably greater after they've arrived, because all of the cases that have been identified to date were perfectly well when they arrived, but they've all presented to doctors or emergency departments on the basis of their knowledge of the risk. So the most important thing is to get that information out there. So we feel that is a proportionate measure.
Should we be quarantining these passengers when they arrive?
There is no evidence to suggest that, and I'm not aware of any first world country that's doing that. I don't think there's sufficient evidence of the risk. I think, as I said before, now that the Chinese government has locked down the Hubei province, which is where the majority of these people have come from, it's quite hard to get out of China from those at-risk areas, and we think the risk of someone coming on current flights is probably very low, so you might be quarantining thousands of people for little benefit.
Do you think, like Rome and other cities, we should cancel Chinese New Year celebrations here?
We don't believe that there is any reason to cancel any public gatherings. There is no evidence of human-to-human transmission in Australia. Were there evidence of human-to-human transmission, that's a very different matter.
There were 11 people in Melbourne being tested those people now clear? Or?
I haven't got the final update. All I know is that as of half an hour ago, there were no other highly probable cases in Australia. But there are people being tested every day, and there will be more probably that turn out to be positive.
Is that the same situation then in Perth? We were told there was 4 people in isolation there.
I think I'm advised that one of the people being tested in Perth may be positive, and the others look like they may be negative, but that's still to be confirmed. Yeah.
The Chinese Health Commission is now saying that people can be contagious during the incubation period. Is that something that you accept, and does it change your response at all?
Again, the expert panels that met later today were not convinced of that at the moment. They were not convinced that evidence has been presented. It would be very unusual because this virus is similar to the SARS and MERS viruses, and they were not infectious before symptoms, and the evidence that we've seen doesn't suggest that there's clear proof of that. But we're urgently seeking advice from the World Health Organization and international experts, because if that were to be the case, it would have implications for how we do contact tracing.